And bladder cancer ranks 6th in the U.S. based on the rate of new cancer cases. It's according to the Centers for Disease Control Prevention for the year 2019. That is the latest year there's available data. Dr. Zaid is a urologist with Urology Austin. And Dr. Zaid, thank you for joining us to discuss this.
Great. Thank you so much for having me this morning.
Yeah, welcome to Midday, his first appearance. So May is Bladder Cancer Awareness Month. What do we need to know about bladder cancer?
Yeah, first off, thanks for having me this morning. As you had mentioned, bladder cancer is the 6th most commonly diagnosed cancer in America. That means last year around 80,000 Americans were diagnosed with this cancer and around 20,000 passed away from it. Bladder cancer can have a variety of different symptoms. Not all patients have symptoms, but some of the common symptoms we can see include visible blood in the urine, increased frequency of urination, discomfort with urination, pelvic pain, or discomfort. Not all patients who have bladder cancer will actually have symptoms. Some patients have a small amount of blood that's found incidentally during a routine physical exam, or they have an imaging test for other reasons that indicates a problem with the bladder. But we really want patients to be aware of new urinary symptoms, especially visible blood in the urine, which should trigger a call to your primary care doctor or urologist for further evaluation.
Yeah, that's a little bit alarming. So Dr. Zaid, why is raising awareness and funds for research important?
Yeah, this is a really important question. Prior to the last several years, there hasn't been a lot of awareness or recognition of bladder cancer. And over the last couple of years, the Bladder Cancer Advocacy Network has arisen as a patient-driven organization nationally and internationally to raise awareness both in the public and the medical community about bladder cancer, symptoms, diagnosis, treatment options, and support resources available for patients and care providers. Diagnosis can be challenging, it can be life-altering, it can be isolating, and having a community of patient and patient advocates is key.
Yeah, Dr. Zaid, that's what we're doing here today. And of course, you at home can take part by joining the annual walk to end bladder cancer happening all over the country this Saturday. Right now, you're taking a picture courtesy of Dorothy De La Garza. She is a bladder cancer survivor. This is her family from last year's walk. Now in Austin, that walk will be held at Waterloo Greenway Park at the Winkler Family Wetland Terrace. That address, 500 East 12th Street. Registration starts at 9 o'clock. Anything else about this walk, Dr. Zaid?
No, I just really want to give a shout out to Dorothy and her husband John. They're amazing stalwarts of the Bladder Cancer Advocacy Network. I would encourage all viewers to go on the website, bcan.org. Amazing resources including handbooks for care providers, patients, but recognition and knowledge are key. And please, if you can make it to the walk this weekend, that'd be fantastic.
All right, Dr. Zaid, thank you so much for helping us raise awareness on this important issue.